The pandemic has touched all of our lives in some way. COVID-19 hasn't affected every community in equal measure. It's turned to hard-hit LA County. The Latinx community has been disproportionately affected, with COVID-19 deaths up over a staggering 1,000% since November.
Wow, it's hard to get your head around numbers like that. So here to update us on his county's battle against COVID-19 is Los Angeles County Health Officer Dr. Muntu Davis. Dr. Davis, thanks for being with us. We just saw those numbers, and here's another one for you. The rate of coronavirus deaths in the Latinx community specifically is 3 times that of the white community. So what is your county? What are you doing to try and combat this, to try to fix these numbers?
You know, we're trying to look at what we're seeing in terms of where the risk is. One of the things that we did very early on is to make sure that we had orders in place for places that were still going to be operating. We know that a lot of our communities of color are essential workers. They've been working throughout this pandemic. So we've tried to make sure that risks were mitigated in the workplace. Beyond that, we've had housing available for those who can't isolate or quarantine. We know that we have to do what we can to make sure they know if there are supports needed if they're infected. But in either case, the best thing to do is to get information out and support so people can do what they need to do in order to protect themselves.
And to the vaccine now, from vaccine sites, I know there are a couple of mass sites that are set up now out in LA, from getting it to the communities that need it most, from getting it out quicker. What lessons are you seeing being learned and implemented? What are we getting better about now in LA County when it comes to getting the vaccine where it needs to be?
Well, you know, of course, you hear a lot of news about how hard it is to get into our appointment system. And a lot of that is just really based on the high demand that people have for getting the vaccine. We're trying to break down our numbers to really understand, break down by race and ethnicity, how successful is it going in terms of getting vaccines into the arms of people in communities most impacted. People are making a really decision about what they need to do. So we're trying to make sure we have as much information out there, answer all the questions, demystify the myths, and make sure that people have good information to make a good choice about what they want to do.
And Dr. Davis, we know that LA County reopened outdoor dining last Friday. One of the caveats is they have to turn their television sets off to try to avoid people from gathering. And we've got a big game this weekend, the Super Bowl. How concerned are you that maybe there could be some sort of super spreaders, if not maybe even at the outdoor dining restaurants, but even in individuals' homes?
We're very concerned. I mean, we've gone through, fortunately, 2 championship teams, happened during the time of our worst surge, with our holidays at the same time. Traditionally, we've seen, videos of people screaming and shouting, yelling and cheering during games, and we expect that might be the same during this time. So we're very concerned. Our case numbers are still very high, and we want people to stay at home and, celebrate and watch the games amongst people you live with. Don't create large parties. It's just going to increase the risk, and we don't want to have our cases go up. We may have to start reclosing things if that does happen. Yeah,
I liked how you just kind of slid in there that you got 2 championship teams out there recently, Doctor. But well done, well done. No, one other thing, how much of these variants keeping you up at night? I think at least 3 variants have been identified specifically in LA County.
Yeah, so we're worried about the variants. I mean, this was a new virus to begin with, and so now we have new variants which may act differently. We know that the B.1.1.7 or the UK variant, was transmitting more easily. There may be some information coming out that it actually is causing more severe disease. So we have to pay attention to that. We also have to see how well the vaccines are going to work against it. So far, they are working. And for some of the variants, it's not as effective, but that doesn't mean that they're not effective. So we are paying attention to how much is circulating to see if it changes our recommendations moving forward in terms of how to control it.
Dr. Davis, it's hard to imagine just how difficult these past months have been for you, for all the medical professionals who are working there in LA County. For the rest of us, can you give us some perspective of the emotional, the physical, the mental toll all of this is taking on people working day in and day out to try and prevent the spread and the deaths here in your county specifically?
Well, to be honest, I think everybody, even in our community, our businesses and our residents have been impacted heavily and negatively in many ways, trying to control this. But for us, looking at these numbers each day, it's tough to see the death counts. It's tough to see the cases. It's tough to see the hospitalizations. But each of us who are working in the public health arena and in government are doing what we can to try to slow this so we can get back to a much more normal life, something that we knew before all of this started. But I don't want to underestimate the impact that it's had on our community. It's been tremendous.
Well, Dr. Davis, we appreciate you, your time. We know you're a busy man, and really all the healthcare professionals out there are extremely busy. But we appreciate you taking some time with us. LA County Health Officer, Dr. Muntu Davis. Thanks so much.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.